Welcome to the program of Master Theatre Program on Healthcare Communication. I'm very glad and thankful to all of you to have signed for the program. And it's going to be a wonderful journey for all of us because it's something new that you must be learning because we haven't talked much about clinical communication and healthcare communication in a formal way. We all have heard about it, but we haven't discussed it. So before I move further, I would like to give some technology reminder so that we all keep in mind. Give me a second to share my screen and give you a couple of points that we will keep in mind when we are. One second, I think there's somebody who's joined. Okay. So is my screen visible to all? Thank you. Thank you. So one thing that I will request that keep your on your device, keep the gallery view on so that you can see everybody, because it's a hands-on training program. It's an interactive program. So we need to see each other. We need to interact with each other. It will be more like physical kind of a setup. Only thing is because we are joining from different places. So therefore we need to have the gallery view on so that we can see each other and interact with each other. So as I said earlier also, please keep your device on mute mode. And when you have to speak, you can unmute and again go back to mute mode so that there is no disturbance in the overall program. Keep your video on throughout the session. I can see some of you already have your video on. I request everyone who has joined to keep their video on, sit at a place where you can comfortably join and interact. Because when you have your video on, your mind stays focused on the discussion. With the video off, I wouldn't be knowing where you are, and you can also, get distracted with your surroundings. So please keep your video on to keep yourself engaged in the program. Only when you're moving from one place to another, please stop your video, because sometimes when you're joining from your home, you may be in your home clothes and in a very informal way you may be sitting. So please have your video on when you're moving. And then once you sit at a place, then you can have your video on. And please respond to the prompts in the chat box. When I say please answer in the chat box, I request you to go to the chat box and reply. Since we are just 10 or 12 of us, I think even unmuting and speaking also is perfectly all right. But otherwise, sometimes when we say that, okay, what is your opinion? And if you want to write and respond, even that is perfectly all right. And please make sure that your correct name comes on your screen, because it will take us little time to know each other. So definitely once we know, then we'll know each other's name, but it's good to have your name on the screen so that we can call each other by proper name. Some ground rules that we will all follow. One is, please, I request you to speak for yourself and be mindful of others. We are coming from different socio-cultural background, different practices, different experiences, but we have to be respectful towards each other's comments or opinion. We may differ on certain opinions, but that does not mean that we argue on that or we get upset about it. We just need to be respectful and understand and accept whatever the reality is. During discussion, a lot of us will come up with the challenges that we are facing in our individual setup or in our individual practices. Also, we may we may share our vulnerabilities, but that will be from the point of view of sharing and learning from our mistakes, learning from each other's mistakes. So we'll follow the rule of confidentiality. Whatever we discuss here, that will stay in the discussion and will not be pointed out later or used later for against each other. So confidentiality we will all maintain. We'll respect the decorum of the program. So everyone has experience communicating. A lot of you are coming with a lot of understanding, experience, expertise in your in your own respective areas. It will be really wonderful to have you here and make you share your experience with all of us. But at the same time, we need to give chance to everyone to contribute. A lot of time, people who are more experienced, more learned, they like to share their learning, which is perfectly fine. But then it sometimes stops others from speaking. So we have to make sure that everybody participates and everybody contributes. And active participation is the only way to learn together. And you just need to be with me in the journey. And this is my responsibility to make sure that you thoroughly enjoy the program and you go back with a lot of great learning from the session. Uh, there will be opportunities to give feedback to each other. Once we'll do role plays, I'll be asking all of you to give your thoughts about the feedback, about the role play, what that person did, how that person did, how effectively that person did. But the whole idea of doing these activities is to encourage everybody to participate. So when you're giving your feedback, please focus on these strengths rather than commenting, oh, you didn't say this, you could have said this was the way, this was not the right way of doing it. Instead of that, we are going to focus on the strengths of the person who performs, because it's not easy to sit in front of camera and do a role play or do an activity. But we will make sure that we make each one of us comfortable and encourage participation. So when you are giving feedback, please be specific and non-judgmental when you are giving your feedback. And trust is earned and it takes time. Like, for example, I know we are meeting for the first time, so even you will be judging or at least kind of in your mind contemplating what are we going to learn, what is she going to teach us, what is so important that we are spending 2 hours at this time of the day. We have whole day been very, very busy with our work, and now we have to sit and but you just need to have this trust that with time you will be able to see the benefit. I'm sure by the end of today's session you will have clarity on what we are going to do, why we are going to do, and what is in it for you, because we don't like to do anything when we don't see personal gain or personal benefit out of it. And we are going to talk about it, that how this program is going to personally benefit you, professionally benefit you. So it takes time. Just be with me and move with this trust that we are going to have a great learning experience. And the last point that I want to say is that keep your phone on this silent mode. In case if it is very urgent and you need to take, I request you to, give me 1 second. There is somebody who wants to join in. Yeah. So keep your phone on the silent mode and keep it, avoid as long as you can to take the call. Only if it is very urgent and unavoidable, then I request you to go on mute mode and, for a couple of seconds you can take, but keep it very, very short. That is something that I think we have to, yeah. So moving further, before I tell you what this program is and what we are going to, learn through this program, we'll actually have a small introduction. So in the introduction, I would request you to keep the introduction very short. The time is 60 seconds because we don't want to spend a lot of time introducing. We are going to interact with each other in the next 10 sessions. So I'm sure we'll have a lot to know from each other and learn from each other. But please keep your introduction very short, 60 seconds. Tell us about you, tell us what do you do, and also if you could, tell about your name, whatever you are comfortable sharing about your name, what is special about your name. So that's just to, make the environment more relaxed. So maybe I'll do the beginning and I'll pass the baton to the next person, and then you can keep passing on to the next person so that each one of us get a chance to introduce. We have two people in the program whom you may not be knowing other than the doctors who have registered. One is Radhika, who is coordinator from HVDesai, who is the coordinator of this program. So I would request Radhika also to introduce after towards the end. And then we have Dr. Lavanya joining from US. She's one of the interns with me. So I request Lavanya also to introduce herself when your turn comes in. So I think I'll take the lead and I'll introduce myself. I am Dr. Indu Agneja, and I am a psychologist, but into healthcare communication training programs for almost like 35 years. I am visiting faculty to a lot of prestigious organizations like IIM Ahmedabad, Accelerate Jamshedpur, Delhi Judicial Academy, Maulana Azad Medical College, and a lot of other organizations. So I'm very glad to tell you that I've done around 2,000 programs on a same topic across the country, and I'm working with a lot of organizations on a regular basis. So I'm on a mission to create trainers in healthcare communication, because that's one area we don't have many people. And that's the whole idea about, developing this program. I have written a book for medical students, Fundamentals of Clinical Communication. But anybody and everybody who is in healthcare will be definitely benefited, because this book is primarily written keeping in mind the Indian healthcare delivery system. So I'm sure if you can get a copy of it from Amazon, you will really enjoy reading it. Right now, I'm in US. I've joined from US. Time in US is 6:30 now. I got up at 4:30 a.m. to be with all of you for this program, and I'm very excited to meet all of you. Regarding my name, Indu, in Hindi, it is Chand, moon. And I believe special about my name is that I take light from sun, like moon, and I shower people with coolness, with pleasant feeling. This is what I try to do. So I pass the baton to Dr. Asim Singh. It's a pleasure to have you, sir. I request you to introduce yourself and then pass the baton to the next person. Yeah.
Good morning to you. And
sir, please
Lavanya.
Unmute your device. We are not able to. Oh, you are not, I think, connected on audio. That is why we are not able to hear you.
Okay.
So by the time you fix the I know these are technological glitches. No, your device is not connected. Audio is not connected. Maybe you have to log out and log in once again, and then when you log in, you have to mention.
Yeah, am I audible now?
No, sir, I'm not able to hear you. I don't think anybody is able to hear.
If I may interrupt, I can hear, sir.
Even you are
I
not
can
audible.
hear, doctor.
I can also hear.
Yes, ma'am. We can hear him.
Am I audible to everyone?
Yeah, you are also audible, ma'am. He's also audible.
I am. Can somebody, Dr.
Yeah.
Atul, can you unmute and speak so that I
yeah. Everybody is audible.
No,
Yeah.
I'm not
Can you
audible.
hear
I
me
can't
now?
hear anybody. So there is some challenge.
Dr. Asim Shil is audible. Madam, you are also audible.
I think ma'am has mute sir or
Am
something
I audible?
like that.
You are audible, ma'am.
You are audible.
I think your speaker will have some problem.
Oh, even I'm not able to hear.
So did you mute my connection?
Hear. So I'll just remove my.
Yeah, am I audible now?
Yes. I think her speaker is not working in the device. Some issues will be there with her speaker.
So I log out and log in. I think I'll log out in, but if I log out, will the recording be on?
Hello.
I will log out and log in. Give me a second. I'm sorry.
Ma'am, you are not audible right now. So you are audible.
Am I audible?
Yes.
So yes, sir. You are audible.
Okay. Okay. So some technical glitch will be there sometimes.
Am I audible?
Yes, you are.
But I'm not able to hear. I'm really sorry. And I'm not even able to log out.
Am I audible now?
Yes.
Oh, yes. And I can hear all of you. Now. Thank you. I think there was some.
Yeah, can you hear me now?
Yes, I can hear you, sir. Sorry.
Okay. Okay. So these are all technical experiences. What we should say.
Yes. Yeah.
I am Asim Shil. I'm an ophthalmologist come public health person because I studied ophthalmology from Madurai Aravind Eye Hospital, and then I did my master's in community ophthalmology from Moorfields Eye Hospital, London. So I am practicing in rural areas of West Bengal for last 28 years. So as a part of my journey, I had to start with educating people. So that's why this course is very fascinating for me. And if you ask about the meaning of my name, Asim means endless.
Endless.
Thank you.
Thank you so much, sir. I have personally interacted with you and Shubhra ma'am, and I'm really impressed with the Z you are functioning in a area like NNN hospital. I have personally visited your hospital, and I really found everybody's, contribution excellent. It was a pleasure meeting you. Thank you so much for being here, sir. It's an honor. It's an honor to have you here. So whom do you want to pass the baton?
I can see Dr. Atul next to my picture.
Absolutely.
Hello everyone. Good morning, ma'am. Good evening to everybody else. I'm Dr. Atul Hegde. I'm working in HVDesai Eye Hospital, Pune. Am I audible?
Yes, sir. You're audible.
Yeah,
you are.
So I'm working in HVDesai Eye Hospital since last 19 years. I'm working there in the general ophthalm department as well as the medical retina department. I also look into the training department, and I also overlook the counseling and the training department. So I think this course will be useful for me also. I had already actually been to Madurai for the 3-day course. Dr. Asim Shil was there with me. So there also we could get some inputs into the counseling training. So I think this will be very useful for me. And my name Atul, it is uncomparable. Atul, uncomparable.
Yeah, wonderful. Thank you so much, Dr. Atul, for introduction. Thank you. Whom do you want to pass the baton?
Dr. Varsha.
Yeah, am I audible, ma'am?
Yes, you're audible.
Yeah, good morning, ma'am, and good evening, everyone. Myself, Dr. Varsha Purani. I am working as an anterior segment surgeon at HVDesai Eye Hospital, and I'm also looking over the low vision services here. And I'm very eager to learn about this communication skill, how to improve these interpersonal and doctor-patient relations. And the meaning of my name, Varsha, is rain. So I hope everybody likes the rain, my presence also makes the environment cheerful and fresh.
Wonderful, wonderful. Thank you so much. Pleasure having you, Dr. Varsha.
Yeah,
thank you.
Same here, ma'am.
So whom do you want to pass the baton? Yeah.
Dr. Snehal.
Hello, everyone. Am I audible?
Yes, you're audible.
Yeah. Hello, ma'am. Hello, everyone. I'm Dr. Snehal Ghadge. I'm working in cornea department as a cornea surgeon in HVDesai Eye Hospital. And my name Sneha means love, and Snehal means lovely, actually. And I'm really want to attend this program, and because we day-to-day life we are doing counseling and other things, but with this program, with the help of this program, I think I can do it in more authentic way, in a more well manner. So thank you.
Thank you so much, Dr. Snehal. Pleasure having you. So whom do you want to pass the baton?
Dr. Abhilasha.
Yeah. Yes, Dr. Abhilasha. Please unmute your device. Dr. Abhilasha, are you there? Okay. So I think by the time I think there's some challenge with her device. Somebody else could introduce. I think I would request Dr. Shubhra to please introduce herself. Ma'am, please unmute your device.
Shubhra, please unmute your device. Can you hear me?
Yeah. Good morning, madam. And I'm Dr. Shubhra, working at Netra Niramay Niketan since 2001. I did my post-graduation from Aravind Eye Hospital, Madurai. And there they had a wonderful counseling training program. It is a 2-year training program. And that time I was in my final year, and I was really fascinated the way they used to give so much of importance to counseling. And after interacting with you for a couple of days, I really learned so many skills, and some of the techniques have been applied into our counseling department, and we are seeing the results. Our counselors, they are doing very nice job in converting. The surgical acceptance rate has really gone up in the last 1 month. So we were discussing about the numbers. Thank you, madam. I learned so much from you, and looking forward to learn much more in these sessions. So I hand over the baton next to Mandavi, Dr. Mandavi.
Thank you so much, ma'am, for this feedback. Thank you.
Yeah.
It's very encouraging. Yes, Dr. Mandavi, please go ahead. Yeah.
Hello, good evening, ma'am. I'm Dr. Mandavi Sengupta, and I'm an ophthalmologist, and I'm currently working in Netra Niramay Niketan Eye Hospital. And actually, there is no exact meaning of Mandavi. It has been taken from Ramayana. So I have really learned a lot in your previous session, and I'm really excited about this session so I can learn more and implement it in my day-to-day practices. Thank you.
Thank you so much. So whom do you pass the baton?
To Dr. Sabyasachi Chakraborty.
Yes, Dr. Chakraborty, please go ahead.
Hello, everyone. Am I audible?
Yes, you're audible.
Yeah.
Thank you.
I am Sabyasachi Chakraborty. I'm a pediatric consultant who has joined NNN Chaitanyapur, and I'm working there for the past 1 year. I finished my residency from Aravind Eye Hospital, Tirunelveli, and went on to do a fellowship there. I was working as a consultant there and came and joined here. My name Sabyasachi in English means ambidextrous. It is actually another name for Arjuna. Thank you. I'm loving your session.
Thank you so much, Dr. Chakraborty. Thank you. So whom do you pass the baton? I think Lavanya and Radhika and Dr. Abhilasha. 3 people are left.
Dr. Sumanta,
I pass the baton to Dr. Radhika.
Okay. Radhika, are you there?
Yes, ma'am. Dr. Ashwini just finished her CME, so I was speaking with her.
Okay, okay. So, like to introduce, but I request Dr. Yeah, Radhika, go ahead. Yeah.
Hi, hello everyone. I'm Radhika Nimkar. I'm a project manager at HVDesai Eye Hospital, and I'll be coordinating this counseling training session from HVDesai's behalf. And so my name relates to Radha, which is Krishna's love. So I believe that the best way to connect with everyone is with a little bit of kindness and love. So that's all from my side.
Thank you so much. Wonderful having you here, Radhika. Thank you. So, Dr. Abhilasha, I think you are back, so we can request you to please introduce. Yeah.
Am I audible right now?
Yes, you're audible.
Yeah. Okay. There's something technical difficulty with my speaker. Okay. I'm Dr. Abhilasha. I'm a pediatric ophthalmologist. I joined my current HVDesai Eye Hospital Institute in 2021. Before that, I was working at Tertiary Eye Care Center, one of the government medical college. I have passion, or passionately I can explain it to all the needy people. That all roots come from my government medical college, where the routine equally like the treatment, we used to believe on counseling, because there was no role of parents' contribution in the child's care. It was always like a counseling, and then only it will eventually happen. After that, each fellowship institute and all the super specialty fellowship institute contributed in its own way. But I always think that your roots always keep you pushing whenever there is a difficult time. And definitely at HVDesai Eye Hospital, being the subspecialty services, we are contributing and learning in a different way with each etiology. The way we presented last one, thanks to you, because we analyzed our own counseling services, we always realize that we think that we have mastered. Once we mastered our degree, like once we get the MS or pediatric ophthalmology fellowship degree, we feel that we have mastered everything. But each patient, each different family coming with the background, coming for second opinions, some are not happy with the treatment. Every patient keeps telling us that we are still in the learning process. And I think that's why we all are here right now.
Thank you so much, Dr. Abhilasha. I think I've seen you working with your patients, and I have seen your dedication in helping your patient and interacting with them. I'm really impressed with your efforts. Thank you so much for being here. I think we have some more people who are not visible on the screen because their camera is off. Can I request? Yes, Dr. Sumanta, please. Yeah, go ahead. Yeah. Please unmute your device, Dr. Sumanta.
Am I audible?
Yes, you're audible now. Yes.
So I am Dr. Sumanta Kumar Vera. I am the Chief Medical Officer of VMA NNN and HVDesai. I am a corneal surgeon.
So what is special about your name, if you're comfortable sharing something about your name?
Probably means a beautiful mind from the beginning to the end.
Excellent. Wonderful. Pleasure having you. Thank you so much. Thank you.
Actually, he is convalescing from a road traffic accident.
Oh my goodness. Oh.
He has joined from
home.
His home.
Yeah. I hope everything is fine. Not like very serious thing.
Yeah, fortunately it is.
Thankfully. That's so good. So wish you early recovery, and I'm sure these sessions will motivate you to recover faster. Thank you. Thank you. Dr. Ashwini has also joined. If you could introduce yourself.
Yes, ma'am. Sorry for the, actually I was part of CME and I had a presentation, so sorry for the delay. I'm Dr. Ashwini Gaikwad. I'm a cataract and glaucoma consultant in HVDesai Hospital.
Can I request you to have your camera on, because we would like to see you. Everybody would like to see you. Oh, great. Thank you.
Yes, ma'am. Yes. Actually, I had a presentation, so I'm late and probably missed some part.
That's all right. Please introduce yourself so that everybody knows you. Of course.
Yes, I'm Dr. Ashwini Gaikwad, and I'm cataract and glaucoma consultant, HVDesai Eye Hospital, Pune.
Thank you. And what is special about your name, if you are comfortable sharing?
Yes, I'm Ashwini in actually in Marathi, it's a group of star, nakshatra, we call it.
Okay,
So
wonderful.
I'm, yes.
So we have a moon and we have a collection of stars with us, and rain and smile and love. Wonderful, excellent. Thank you so much, Dr. Ashwini. So can I request Dr. Lavanya to introduce?
Yeah, thank you so much. So I think I'm the junior in the group. I'm an MBBS graduate. I graduated in 2021 from GSL Medical College, Rajahmundry. And after that, I moved to the US. I'm going to be transitioning into a master's in health administration degree. I think the leadership roles that I've done in my undergraduate kind of inspired me to go into healthcare delivery and pursue that. But right now, I'm working as an intern with Dr. Indu ma'am, and I think that I wanted to learn from her because it would definitely help me in my career moving forward and the way I see patients in a management level as well. So my name it means basically, if you Google it, it means grace. But if you look deeper, and the real concept behind it is it's used to describe a woman who has all the qualities that you would expect of a woman, technically. But so I hope to live up to that name and contribute what qualities and skills I've learned along the way to healthcare and the world.
Thank you so much, Lavanya. Pleasure having you here. I hope everybody has introduced. I hope I haven't missed anybody. Okay, so before we move further, I want to send you a link about pre-training assessment. Whatever we are going to do in the program, before that, we want to see where we stand. And has this training been able to, bring some change in the way we are functioning, or in our knowledge, or in our skills or attitude? So I'm going to share the link with you. I request you to complete that quickly. A lot of things we may not be knowing. A lot of things we may be at a very, very elementary level, which is perfectly all right. That is what this training is meant for. So give me a second to share the link with you. And give me 1 second, yeah. So I'm sharing the link in the chat box, and also I think I'll post in the WhatsApp group. Give me 1 second. So I've shared the link in the group. Please see if it is working. And I'm going to paste in the WhatsApp group also. Yeah.
I have received 4 responses as yet, waiting for others to complete. Yes, I have received 8 responses. And Dr. Sabyasachi, I have received your response. So Dr. Snehal, I have not been able to see your response. Is there some challenge at your end in submitting
No,
the
I have
response?
shared through WhatsApp.
No, Dr. Hasim, yes, I've received yours. Dr. Snehal,
Okay.
her response I can't see. Yeah, Dr. Snehal's response I can't see.
Hello.
Yes, Dr. Snehal. Yes.
Yeah, I submitted. Okay, I'll try it again. Okay.
Yeah, because I can't see your name in the respondents. Yeah.
Okay. Okay.
Yeah. Please try doing once again.
Yeah. Okay. All right.
Going further, before we actually start with the discussion, I just want to give you an overview of what this program is all about and what we are going to cover so that we all know where we are going towards. So this whole program has been conceived with the idea of, first of all, empowering ourselves with the understanding what health communication is about. We all know that as of no form available, and with communication member with our but we have to patient senior and this program has
Your
been
voice is breaking, ma'am.
Is it?
Is it the same for others?
You're not audible clearly, ma'am.
Yeah,
Yes,
yeah,
ma'am,
you are
yes,
not
ma'am.
audible.
No,
No, not yet. You're not audible clearly.
not audible, ma'am. No, ma'am. No, ma'am. You're not audible, ma'am.
Am I audible now?
Yes, ma'am.
Yeah, you're
Yes, it's
audible
clear
now.
now.
Yes, yes.
Yeah, it is
Clearly
clear.
audible.
I think there was some network challenge on my side. Okay. Okay. So can I request everybody to come in, please? Keep your cameras on. Thank you. So the whole idea about this program is, first of all, we all need to learn different aspects of patient communication. So therefore, if you will look at the list of the topics that I have covered, it covers almost everything from what is the importance and relevance of communication in healthcare, how is it different, how we need to communicate with the patient. Also, there are some intense communications, like when you have to handle an uncooperative patient party, or when you have to break bad news, or when you have to disclose any medical error or something that has happened wrong in the patient care. So these are all very intense communication, and we all know that there is no formal training around these topics. So we have tried to cover almost everything relevant to patient communication in this program. This program is of 10 sessions of 2 hours each. We'll be meeting every Friday, 4 to 6 p.m. and we'll cover each topic one by one, not through PPT, not through just, kind of webinar, but it will be an interactive hands-on program. You all will be participating. We all will be doing role plays. We'll be watching videos. We'll be doing a lot of, introspection activities where we will introspect our own behavior. So only thing that I expect from all of you is please leave away all your inhibitions and participate fully. And that is why I have been repeatedly saying, please join from a place where you are comfortable, be in your room, be in your office, but there should be no disturbance around you. And you should join from your laptop so that you can see everybody. It should actually give you a feeling that you are in a classroom and you are participating, in a physical kind of a setup. So the focus of this program is primarily on 3 things. One is that we need to understand what is the content. So I've shared the content with you. I've sent you a 60, 70 pages document. Go through that document. You will get an idea about various aspects of communication. If you can get hand on that book that I talked about, that is Fundamentals of Communication. And if you can get, this book is very reasonably priced just because everybody can have it. I think your even hospital library has it. If you ask your management to get more copies, I think they can get a copy for each one of you, but each one of you should have a copy, and it covers a lot more than what we are going to cover in the program. So focus will be on content because we need to become familiar with content. That is one. And second is the facilitation part, because we are hoping that after the program, you will be able to do training for your staff. Maybe for your nurses, for your optometrists, for your patient counselors, even for your junior doctors, for fellow colleagues. So we expect you to do the training. For that purpose, we are going to work on your facilitation skills, your training skills. So the idea that I have, designed about this program is, so you will be watching me using different facilitation pedagogies. I'll be using role plays, storytelling, puzzles, questionnaire, which I want you to make a note of what I am using, in different, because just PPT and webinar is not a very good idea. Besides that, session 5 onwards, you all will be making a 10 minutes presentation. So I will be sharing a list of topics of different pedagogies in session 3 or 4. you will be expected to choose one topic. Somebody can choose storytelling, the other one can choose quiz, the third one can choose reflective questioning. So there are around 14, 15, different pedagogies that are listed. So you can pick up any one, and you will be making a 10 minutes presentation on each pedagogy. So we will learn from you. For example, if the person who will pick up storytelling, that person will talk about what storytelling is, how to use in a program, how it is beneficial, what are the do's and don'ts, just in 10 minutes. And you have to make just 4 or 5 slides, not a very huge presentation, but more of what you are doing and how you can use it. So that way we will learn good 10 to 12 pedagogies from each other. So as a result, by the end of the program, you will know about different pedagogies that you have not used, but you can use in your training program. So we want to work on your facilitation skills. Some of you may be having thorough understanding of the topic, but when it comes to delivering, sometimes we are really not good at it. So the benefit of this whole activity will be that when you are presenting in your CMEs, because I'm sure most of you are already doing it and you will be further doing it. So you can learn from this and, transfer this knowledge to your clinical presentations also. When you're teaching your patients, when you're counseling your patient, so these pedagogies can help you in counseling your patient. When you're teaching your staff, even on one-on-one basis, these pedagogies will help you to make your presentation and discussion impactful. Again, the whole idea is that I request you to participate. That's all. That's only one thing that I'm expecting from all of you. So this is in nutshell about the modality of the program, and the certification, of course, will be done. Only thing compulsory is please attend all the sessions. Don't miss any session, because if you miss a session, you'll be missing a topic. We have actually kept 2 topics very specific for programming. One is designing a successful program, because we sometimes do not know how to design a program. A lot of time we have a wonderful idea, but when we don't have a impactful design, the program does not give us that result. And then one session on how do you successfully facilitate a program. So the whole session is going to be devoted on these 2 topics. 2 sessions are going to be devoted, other than the other clinical topics that we are going to cover. So each topic is very important. I've shared the list of topics. In the same order, we are going to have the discussion on in each session. So I request not to miss this session. And of course, after you attend all these sessions and participate and do your presentation, you will be eligible for a certificate of master trainer program from Indian Institute of Healthcare Communication. So this is in nutshell about the program. Any questions as of now? Any questions as of now? So when there are no questions, what exactly that means? Either we agree or we don't agree completely.
We agree, ma'am.
There is full agreement.
We understood whatever you are told.
Yeah, thank you so much. So today's session, we are going to actually, 1 second, I can, Dr. Sabit. I will do it, Dr. Chakrabarti. I'll send it. If you have not received it, I will send it. I'll do that. Okay. So today's session, we are going to first of all understand what is the relevance of communication. Why do we need to learn? So if I may ask you, I think 10 years earlier, or maybe 10 to 20 years earlier, did we have any discussion like this? Did we ever discuss anything like this?
No.
No.
Actually, no. Actually, no. So Arvind Hospital, if they developed a counseling program, I really salute them for them being farsighted. So they understood that patient needs to be counseled, patient needs to be explained. For that, we need to have communication. But I say, why have only patient counselors learn counseling? As doctors, as nurses, as paramedical staff, everybody should know communication and counseling, because we interact with the patient. Why are we talking about this? What is the need? What has changed?
Patients are much more well-informed, better informed.
Absolutely.
And it's not only the patients, the next generation members in their families.
Absolutely.
They're well-informed.
Absolutely.
And
awareness of the patient has been increased right now.
Absolutely.
And they have more access for all the things like diagnosis to treatment part. So they are more aware.
yeah, and we have to pass on the newer developments of science to the patients. And before that, we should take them into confidence.
Absolutely, I completely agree. So I invite everybody to write their opinion in the chat box that why do we need to learn communication and interpersonal skills. I request everyone to share their thoughts in the chat box, or if you like to unmute and speak, you're more than welcome.
Ma'am, I'd like to add something. I think that along with a lot of information that they have, there's a lot of misinformation present, and we have to, talk about that as well, so that, they don't consider that we're doing more harm than good.
I think that's a wonderful reason that you have listed, because there are a lot of misinformation, even on Google, because a lot of information is unauthenticated. And we know there's no evidence to it, but then people just believe it because it's on Google. So we really need to clarify those myths and doubts and those misinformation. Absolutely. I completely agree with you. What do others say? You can write in the chat box, or you can, yes, I can see a response in the chat box. Yes, Dr. Chakravarti has written, better interpersonal skills and communication skills will end up in more satisfied patient and better practice. Absolutely, absolutely. I completely agree. Patients don't care for your qualification, but patient care for your communication, your behavior. That is why quacks have a better practice than a lot of qualified doctors, because they're very effective communicators. Quacks are very effective communicators, and they have wonderful practice just because they are able to hook their patient. I completely agree with you, Dr. Chakravarti. Yes, a lot of, yes, please go ahead.
I feel it's their right to understand about their disease, one thing. And the other thing is, if you communicate with them properly, that improves their compliance with the disease and the medication.
Absolutely. I'm so happy that you're coming up with these ideas when you're saying that it is their right. Acknowledging that it is the right of the patient to know about what they're suffering with, what are the treatment options, what are the advantages and disadvantages of each option, and what is best suited for me. And when you have this discussion, at the end, have you seen what normally patients say when you do this discussion with your patients? What is the usual answer they'll come up with? Doctor साहब आप बताइए मेरे लिए क्या ठीक है? But when you do this discussion, they are satisfied that you have engaged them, you have involved them, you have answered their question. And that's the whole idea about earning their trust that you're talking about, or sending them satisfied. They go window shopping, especially when they're paying, they go window shopping, and they'll only go to the doctor with whom they are satisfied, with who is able to answer their questions. So I'm glad that you are thinking on those lines. Normally we think we need to communicate because now we need to, answer them, and they want more information from us. So they burden us with a lot of questions. But I'm glad that you are moving with this point of view that yes, it's important to communicate because it's their right to know. It's important to know, tell them, clarify their doubts, especially when they have access to information on Google, which was not there 10, 20 years ago. So it's important to make them, aware. I want to share the presentation with you so that we can, go ahead with the discussion about it. 1 second. Okay. Is the screen visible to all of you?
Yes.
Okay. So practice of medicine was much more simpler earlier, as patients had a lot of faith. But now we see patients really, check our credibility on Google and then come to us. Especially the kind of clientele you're going to see in the future, they're going to read about you on and a lot of time, like if somebody contacts me, I see them visiting me on LinkedIn or Facebook or Instagram, and I get the notification that they are looking at my profile on the professional setup. So I'm sure for doctors also, they would do this. And the trends that are changing, like you have already mentioned, that people have become more aware, they have access to information, they are able to, and they are more aware now. And since they are paying, their demands and expectations have also gone up. As a result, our answerability is more. Earlier, I don't think we were this answerable. But now, if you see, anything that we do in patient care, we have to create evidence, and we have to be sure that what we are practicing is evidence-based, because we can be in trouble if we are not following the protocol. In general, I think aggression and stress is on the rise. Do you agree with me on this? And is it only for the patients and not for us? Even we are aggressive and
For us as well.
Yes, absolutely. Even we are stressed out and we are aggressive. So therefore, I think the conflict is on the rise. And that is one of the reasons that is pressurizing us to, learn our communication. Although that's a wrong reason, because when we learn something because of pressure, we are not happy learning it. But when we upgrade ourselves, just to mention here, I was reading an article on LinkedIn. Earlier, they said that skills that you learned had a life of 5 years. But today, skills that you learn, its life has gone half. So almost every 3 years, you will see your skills have gone outdated. The surgical skills that you are learning, you may have seen a lot of surgical skills that you learned when you were graduating and post-graduating, they're completely obsolete now. New skills, new technology, new ways of treatment are coming up. And for that, I think we really need to upgrade ourselves. So the shift is also in the way people are interacting with us. The media is portraying us. Litigation is a problem. Do you see this problem in your hospitals, if I may ask you? Both the hospitals, HVDesai and NNN?
Of course.
There is.
Of course.
There is.
Yeah.
So,
We have also had some litigation issues.
Imagine, I mean, hospitals who are working in such a, dedicated manner and also in a very strategic manner, if they are facing this problem, so you can well imagine unorganized sector where people are not very careful about how they are functioning. So the problem of litigation is increasing. And one of the major problem is the extent of fights. It used to be usually verbal, but now we see patients become violent. They start physically hitting doctors and nurses and other hospital staff. They start breaking hospital furniture and equipment. So that actually brings us to a point where we need to sit and think, are we communicating properly with our patients? Are we really interacting with our patients in an effective manner? The problem is we consider this as not a very essential skill, but actually it's one of the essential skills like your clinical skills. And therefore it's time that we equip ourselves with these skills. Let's see, what do studies suggest? Because that gives us an idea what is happening across the world. So this one study from Institute of Medicine, it's a very prestigious organization in US, that says that patient-provider communication is often inadequate. And one of the primary reasons for this is lack of communication skill training. If a country like US says that we are not doing enough in terms of training, what about India, where we hardly have any training on this front? Then another study where Tong and all found that 75% of the orthopedic surgeons said that they communicated satisfactorily. But actually only 21% of the patients agreed to their opinion. Rest of the patients were not satisfied with the doctor's communication. One of the major reasons for dissatisfaction is when the patient is not allowed to speak or they are interrupted. A lot of time when patients start talking, we think they're talking irrelevant, so we interrupt them. Any idea in how much time do we interrupt our patient when they start speaking? Any idea? Yes? It's okay, even if it's a wrong guess, it's all right, but I want you to guess.
5 to 7 minutes.
Oh my goodness. If you heard your patient for 5 to 7 minutes, your patient will go gaga. Actually, we interrupt the patient within 10 to 15 seconds. Imagine the patient starts speaking about a problem and we think it's irrelevant and we interrupt and we directly take the patient to the immediate problem and we ask the patient to talk about that. And in that also, instead of asking the patient to narrate about the problem, we usually ask, do you have this? Do you have pain? Do you have redness? Does your eye pain or what other thing? So we take the patient to more like leading questions or closed-ended questions, and the patient is not allowed to narrate about their problem. And that becomes, a kind of pain in the patient's heart, that I was not allowed to speak about my problem. We usually think if we allow the patient to speak, they will take longer to talk about their problem. Is that true? And is that the reason that we stop them from narrating about their problem? If we allowed, what do you think, in how much time can they narrate about their problem?
I think in a very busy OPD schedule, we have to interrupt them, because it's not like we can spend 10 minutes, 15 minutes behind a single patient. It's a really very constraining factor in a busy schedule. And everyone has to accept that this is not a very theoretical subject. It's really a practical problem to us.
I'm so happy, Dr. Sumanta, that you brought this up, because that's a very usual problem we face. Patients talk irrelevant, and that's why we need to interrupt them, and we need to really, bring them to the point. But there are two things that I want to really, bring it here, because just saying this, that patient talk a lot, so we need to stop them, and we need to bring them to the point. One is, actually, studies suggest that 70% of the patients are able to talk about their problem within a minute and a half, around 80 seconds to be very precise, 80 seconds to 2 minutes. That is one thing. 15% of patients talk a lot. They need to be brought back to the point. The second thing is, how do we bring them back? So I was interacting with a group of doctors working in a government setup. I've done around 500 programs in a government sector. So there we know the kind of challenges are very different. And even your hospitals, HVDesai and NNN, the kind of OPD you have, I know it's mind-boggling. So there we have a tendency to bring the patient back to the point. But the question is, how do we do? So when patients start talking about a problem or a situation or their story, which is not related, a lot of time we interrupt in a very, very crude manner. So I was talking to one of the group in a government sector doctor. I said, how do you stop your patient when they talk irrelevant? So one of them said, we say, ज़्यादा बातें करने की जरूरत नहीं है, जो पूछ रहा हूं उसका जवाब दो, बाबा कहानीबाजी मत करो, जिस तकलीफ के लिए आए हो वो बताओ मुझे, 10 साल पहले क्या हुआ उसका मुझे क्या लेना देना है. So when I talk like this with my patient, what am I doing?
You're making them feel uncomfortable and losing their trust.
Absolutely. Will they be comfortable?
Actually, we are disengaging our patients from the treatment process.
Absolutely. They will get discouraged. Should I speak further? Should I say something? As a result, you may actually lose on the pertinent information that could help you in diagnosis. 50% of the diagnosis can be made if you allow the patient to narrate their problem and listen to them attentively. Your diagnosis lies in the narration of their problem. Yes, I agree, they talk irrelevant. So instead of saying like this, कि बाबा ज़्यादा कहानीबाजी मत करो, जो पूछ रहा हूँ उसका जवाब दो. If I say, बाबा, अगर आप मुझे अब किस लिए आए, अगर इसके बारे में बताएंगे ना, मैं आपको ज़्यादा अच्छे से हेल्प कर पाऊंगी. अभी बताइए आपको क्या तकलीफ है. And another thing, when we talk like this with an elderly patient, there's always an attendant, either the son or daughter or grandson or granddaughter, who is overhearing my interaction with my patient. And if I'm this rude, that attendant is very, very annoyed with me, that I am being disrespectful with the patient. They feel very bad that my grandfather is being insulted or my grandmother is being, treated in a disrespectful manner. So they carry that grudge with them. And as a result, later on, if they will have any grudge, that's going to actually, come out in an aggressive manner. So I completely agree with you. Patients talk irrelevant things a lot of time, something that is, that takes away a lot of time. And we really need to bring the patient back to the point. But the thing is, if you allow them to speak for initial 1 minute, you will see that they'll be more comfortable that you heard them, you allowed them to speak. And of course, if they are talking irrelevant, we can bring them back, but in a more respectful manner and cordial manner. Our studies also suggest that our communication does not meet the basic standards of informed decision making. We do not actually practice shared decision making? How many of us really talk about the options available? How many of us really refrain from pushing the patient to the treatment modality that we think is best for the patient? Because a lot of time we think it's not a good idea to share all the information because patient will run away. By the way, why don't we share all the information? Why don't we share all the information? What is the hesitation?
So we want to push our own agenda. We want to push our own product.
That's one of the major reasons. I completely agree. What other reasons can you think of?
We think that their opinion is not relevant and they don't know basically. Yeah.
Absolutely. So there was a time when we practiced from the patternistic, point of view, where we thought I'm the best, judge for the patient's treatment, which was okay maybe 20, 30 years ago. But today patient is educated. They have access to information. Maybe what we are offering is not suitable to them. I'm saying surgery, but the patient says, I have an elderly mother at home who is acutely ill and I can't think of my surgery. I need to get my mother treated first. So according to you, the patient's surgery is important. According to the patient, her mother's sickness is important. So priorities could be very, very different. So I remember I was taking a session for a group of anesthetists. And one of them shared his experience. He said, ma'am, once a patient came for PSC and the patient had to undergo foot amputation. She was a middle-aged lady around 40, 45 years, and she had to undergo foot amputation. She was highly diabetic and she had come for PSC. While doing the anesthetic checkup, pre-anesthetic checkup, this anesthetist asked this patient, "Kahan se aapka pair kaatne ka bataya hai?" And that lady was shocked. She said, "पैर काटेंगे? मुझे तो ऐसा कुछ भी नहीं बताया." And then this doctor was really, now confused now where to take this discussion. He said, ठीक है. She said कि मुझे तो ये बोला कि आपको ये डॉक्टर को दिखा कर आइए. मुझे लगा you are also a doctor. He is also a doctor, so he has referred to you. So I have come to you. Now imagine you have already decided on the patient's behalf that this patient has to undergo foot amputation, which is perfectly all right. I'm sure you will have your own reasons to do that. But preparing the patient for surgery, letting the patient know that this is the only last option left now to save you, to save your life. So that means shared decision making now has to be the way of life. But we are hesitant. We think if we talk about the disadvantages or the risks involved, patient will run away. Whereas informed decision making is a sandwich approach. One layer of facts and figure and a layer of assurance and realistic assurance. I'm not saying unrealistic assurance. Yes, this procedure has this risk, but we have all the facilities to manage this complication. Or we have a team of doctors who can look after this. So that means the patient has this feeling or this confidence that, okay, yes, there is a risk involved. I remember in Delhi, there was an eye chain that had a tagline, "Ghar se aiye, surgery karwaiye, office jaiye." I don't know if you know about this tagline, if anybody noticed this. One of the eye chains had this tagline, "Ghar se aiye, surgery karwaiye, office jaiye." That means it's such a small this thing. I'm sure after this surgery, when some patient had nucleus drop or vitreous hemorrhage or other complication, these people realize that such kind of taglines do not actually function in reality for all 100% patients. So we really need to be careful and involve the patient, inform the patient and talk about it. But honestly, we do not actually practice informed decision making. We only share what we think is important and relevant for the patient. Now, coming to the breaking bad news experience, a lot of time we have to, tell the patient about the poor outcome, poor prognosis, or maybe, diagnosis that is very sad. How many of us are really comfortable doing it? If I may ask you, raise your hand. Raise your hand in the chat box, or, you can raise your virtual hand. How many of you are comfortable breaking bad news or talking about these things with your patient?
I don't think anybody is comfortable, but with time and with experience, we modify. I modified myself how to break that news.
Absolutely, Dr. Seal. See, people like you or Dr. Mrs. Seal or people who are senior, they may have had a training or they may have learned by doing it. But how about young doctors? And especially when it comes to if some surgery has gone wrong or the outcome is not as expected or as explained, they're probably the biggest challenge is that we experience a lot of discomfort in ourselves. Like Dr. Chakraborty has very honestly admitted, not very comfortable. That's because we don't know what is the right way of doing, because we don't prepare ourselves for doing it. We really do not know how to go about, breaking bad news. So studies suggest that, in one of the studies, 79% of the patients and 68% families, almost 2/3 of the patients and families said the encounter was suboptimal. So next time when you do the breaking of bad news or talking something which is sad and unexpected by the patient, ask them how do they feel about the interaction. You will get to see that not a lot of them are very satisfied. This study suggests that they found the doctor to be too blunt. Probably the place and the time was not appropriate. Sometimes we do it outside OT, sometimes we do it in corridor, sometimes we do in the OPD when there are others around. So we don't choose the right place and right time to do the sharing of information. And patients sometimes get the sense that there is no hope. So that means we have not been able to balance between sensitivity and honesty. Of course, we have to be honest. We have to give a very realistic picture so that they don't blame us for the outcome and they get prepared for the eventuality. But we got to balance between how we are going to do and how it is going to impact the patient. So these things have to be learned, but studies suggest that we are still miles away from the real picture. Now, what do Indian population say? So what we have talked just now is all about, what is happening across the world. But what do Indian populations say? So I got across this study. I personally attended their seminar actually, and they came up with the finding that 45% of the patients, patients' families reported feeling unempowered in the treatment of their patient. Almost 50%, you can say. They felt the consultation was rushed, or they were not given enough explanation about the diagnosis, treatment, and care options. They also felt that they were not involved in deciding the treatment. So that shows us that almost 50% of the patients are not actually satisfied with the way we communicate with them. 32% of the patients also indicated that the attending doctor did not straight away address their questions and doubts, especially when they talk about the outcome, or they talk about relapse, or they ask a question about the financial implication. We are sometimes not very straightforward in answering this question, and that's what is indicated in this study. If I may ask you, how will we benefit from learning communication? So this program that you are joining, you're going to be with me for 10 weeks, so it's a lot of investment, huge investment of time. If I may ask you, how are you going to be benefited by learning communication skills? Write in the chat box. So we become more comfortable in our practice and earn more trust from our patient. That's what Dr. Asim has said. I completely agree with you. Definitely, I think our own, confidence in our practice would increase, because patients would show that they trust us and they align with us and they comply with what we say. Absolutely, I agree with you.
No, at the end of the day, becoming comfortable is the prime objective of living.
Yes, absolutely. We have to be, happy doing what we are doing. We have to enjoy what we are doing. Dr. Chakravarti says effective communication will result in a shared decision making. This will actually make the patient accept the suboptimal outcome better and avoid anger. Absolutely, I completely agree. So prognosticating is very important, and that can only happen when you communicate effectively and prepare them for the expected outcome. Dr. Varsha says to build up doctor-patient relation, to train other paramedical staff, to teach about communication. Yes, Dr. Varsha, absolutely. This is the aim of the program. Dr. Snehal says, I can counsel my patient in a very authentic way, earn more trust and avoid unpleasant incidents. Absolutely, I agree with you. Lavanya says, this will make a great impact and help me in a way I will deal with the patient satisfaction and experience as a hospital manager in the future. It will help me collaborate and train doctors and staff to help make improvement in healthcare delivery. Completely agree with you. And Dr. Atul says, become more trustworthy and also gain confidence while dealing with adverse events. Dr. Abhilasha says, patient will take informed decision that will avoid further difficult conversation and help to adhere compliance. Absolutely, I think we are spot on. This is what I think the purpose of the program is, that we have to see that we are able to perform better. If I may add a couple of more points here to tell you, not only this, but a lot more will happen if you will communicate effectively with your patient. I think one of the major challenge that we all are facing is medical errors happening in patient care. This is a study by Professor Ashish Jha from Harvard University. He claims that around 5.2 million medical errors happen annually in India. I think this is a underquoted figure. There must be much more than this. So you can well imagine the kind of errors happening across the world. This study by JCI, it says medical errors are the third commonest cause of death in US. I'm repeating, medical errors are the third commonest cause of death in US. Almost like 251,000 patients die annually because of medical errors. We haven't done any study in India. If we did, I don't know where we will stand. A lot of patients are dying or are losing their health because of the medical errors. And most of these errors are result of poor communication. Almost 2/3 of the errors are because of poor communication that happens between us. So medical errors like wrong side surgery, wrong medication, wrong organ removal, wrong treatment, wrong patient, they're very common. Only 3% of the errors get reported. 97% of the errors are brushed under the carpet. Why? Because गलती करने वाले भी हम हैं, बताने वाले भी हम हैं और छुपाने वाले भी हम हैं. How many of us really come out and say that this has happened because of my mishandling? Honestly not. We are not very honest in this. Most of the errors are around medication error and patient care errors. And a lot of them are around surgical errors. So this should tell us where all errors can happen and how we can actually prevent this. So if I ask you to count the number of persons involved in a simple activity like any blood investigation of a patient who is admitted in a hospital, how many people do you think are involved? Can you guess? How many people get involved?
To 5 people.
Maybe sometimes more than that, because it's a patient, then the patient's attendant, then it is the consultant who is prescribing, then the resident who is going and collecting the sample, the person who is going to deliver the sample, and then the person who receives the sample, the person who actually does the actual test on the sample, writes the report, then the report, somebody who goes to collect the report, and then when it is written. So you can see it could be even 8 to 10 people involved, and that many opportunities of errors also. In an average stay of 3 to 4 days, how many hands does the information exchange? How many people handle patient's information? Guess?
8 to 10?
50 to 60 hands. And that many opportunities of error. That many opportunities of error, because the moment information moves from one end to another, it can get, changed. Most of these errors are because of internal communication failure. We do not communicate, carefully or effectively. So we'll do a small activity. 1 second. I'm going to send 5 of you in the waiting room, and I'll bring you back one by one. So I'm not choosing anybody. It's according to the name that will come in my participant list. So Dr. Subra, I'm sending you to the waiting area, and I'll bring you back. Dr. Abhilasha, I'm sending you to the waiting area. Okay. Dr. Atul. Dr. Ashwini. And Dr. Snehal. Okay. So I've sent 5 people in the waiting area. Dr. Varsha, I'm going to show you a set of information. I want you to read it. Others will also be able to see the slide. Others also can, look at this slide, and then I'll tell you the task. Once you have read it, and once you're ready, just let me know that you're ready. I'm sharing it. Yeah. Okay. So you can read this. Yeah. And just let me know when you are. So are you ready?
Yes, ma'am.
Okay. 1 second. There are 4 people in the. Okay. So I'm going to bring one of the participants from the waiting area, and I request you to share the information that you have. Yeah. 1 second. Who are not there in the waiting area? So I'm getting Dr. Shubra. You please share the information with her. Let me explain her the activity, and then you.
Yeah.
I need it. Yeah.
Dr. Shubra, am I audible to you?
So 1 second, Dr. Varsha, hold on. Yeah.
Yeah. Am I audible to you?
Yeah.
Yeah.
So Dr. Shubra, 1 second. Dr. Varsha, hold on.
Yeah.
Dr. Shubra, Dr. Varsha is going to share a set of information with you. Please listen to her carefully. Yes, Dr. Varsha, please go ahead.
Yeah. One patient, Neeraj, 21 years old, admitted on ICU bed number 1, has undergone a calcified tumor removal, which is located in between the rib 3 and 4th by Dr. Shetty, who is cardiothoracic surgeon. And in the morning, he has got numbness below the nipple area. So, and the Dr. Shetty was left. So he has been informed telephonically for the same, for which Dr. Shetty has advised the neurophysician opinion on urgent basis.
Okay.
Yeah, this was the incidence.
Okay.
So,
Done,
Dr.
ma'am.
Shubra, okay, thank you. Dr. Shubra, I'm going to admit the next participant, and I request you to share this information with Dr. Abhilasha, who's joining us. So I'll just explain to her the activity, and you kindly explain in your words whatever you have understood from Dr. Varsha. Yeah. Dr. Abhilasha, are you there? Dr. Abhilasha, can you have your camera on? Dr. Abhilasha, can you have your camera on, please? Dr. Abhilasha, are you there? Okay, so I am admitting Dr. Snehal. So I request Dr. Shubra to share this information with Dr. Snehal. Let me explain to Dr. Snehal. Dr. Snehal, can you please have your camera on?
Yes, ma'am.
Okay, so Dr. Shubra has a set of information she's going to share with you. Please listen to her carefully. Yes, ma'am, please go ahead.
Okay. The 21-year-old patient Neeraj was admitted in the ICU bed number 1, and he underwent surgery, that is calcified tumor removal between the ribs 3 and 4 by Dr. Shetty, who is a cardiothoracic surgeon. And later the patient developed, in the morning, the patient developed numbness below the nipple. And by that time, Dr. Shetty had left, and he was informed over telephone, and he asked the person to consult a neuro physician urgently.
Okay. Dr. Snehal, I hope you have
Yes,
understood. Okay.
Yes, ma'am.
So can you explain in your words to Dr. Abhilasha? Dr. Abhilasha, have you heard the whole thing, or you have just joined?
I was listening what she, Dr. Subra just mentioned to Dr. Snehal.
Okay. So then if you have already heard it, it's all right. I'm calling the next person from the waiting room. Give me a second. Yeah. Okay. So I am getting Dr. Atul. So Dr. Snehal, please share with Dr. Atul whatever you have understood.
Okay.
Let
Hello.
Dr. Atul, can you please have your camera on?
Yes, ma'am.
Yeah. So
Yeah.
Dr. Snehal has a set of information she's going to share with you. Please listen to her carefully. Go ahead, ma'am.
Atul sir, can you hear me? Hello.
Yeah.
Yeah. So there is one set of
Yeah. I can hear you.
information. Yes, sir. There is one set of information. Mr. Neeraj, a 21-year-old male, has got operated for calcified tumor between ribs 2 and 3.
Please repeat, Shell.
Can you hear me, sir? Hello? Yeah.
Yeah.
So, Mr. Neeraj is 21-year-old male, got operated by cardiothoracic surgeon Dr. Shetty for a calcified tumor between ribs 2 and 3. Now he is admitted in ICU bed number 1, and he developed some numbness below the nipple area. So they give a call to Dr. Shetty, but Dr. Shetty is out of town. So he said to call a neurosurgeon immediately. It's an urgent opinion.
Okay.
So Dr. Atul, have you understood the information?
Yeah.
Okay, so I am admitting Dr. Ashwini No, Dr. Ashwini already was there. No. Dr. Ashwini, were you there? She was there, no? Okay. So, Dr. Atul, can you explain in your words what have you understood?
Yeah, patient Mr. Neeraj, 21-year-old, was admitted with Dr. Shetty with some cardiothoracic issue at the level I hear that this something 1 to 2, and he had some problem, and Dr. Shetty was not reachable, and Shetty was not reachable, so a neurosurgeon was to be contacted.
Thank you. So,
I hope it was correct.
Dr. Varsha.
Yes, ma'am. I'm here.
Was this the information that you had shared with Dr. Shubhra?
Yeah. So, sir, there is a 21 years old male, Neeraj, who has been admitted on ICU bed number 1. And he has been operated for the calcified tumor by cardiothoracic surgeon Dr. Shetty at the rib level 3 and 4. Later on, he developed the numbness below the nipple area, and Dr. Shetty was left. So he has been called on telephone, who give the urgent neurophysician referral.
Okay.
So what happened in this activity? What happened in
information? Content of the information got changed.
The information.
Leads number what's got changed, like between 3 to 4 it was, and I pass on between 2 to 3.
And we had to inform the neurophysician, not the neurosurgeon.
Yeah.
And it was not a cardiothoracic problem. It was the surgeon was a cardiothoracic surgeon. Dr. Shetty was a cardiothoracic surgeon.
So see, such a simple set of information. We lost the complete information because the information was, and Dr. Varsha also could repeat the same information because she made note of what she read. That's why she could give us the complete information. You know what exactly happened in this case? This was a real life case that I've shared with you. Those who were outside, this was the actual case. This patient was admitted under Dr. Shetty, and he was operated by him for the calcified tumor. This patient actually complained of numbness in the below the nipple area. Since Dr. Shetty had left, he asked to call neurologist on urgent basis. Even in the transfer of information, I think we missed this point that the neurologist has to be called on urgent basis. Please contact a neurologist immediately. And you know what exactly happened? This is a real life case I'm sharing with you. In this case, the seriousness of the situation was lost in transit of the information. Neurologist came to see the patient on next day, 16 hours after the first complaint of numbness. Patient suffered irreversible paraplegia and had to be compensated by the hospital. This is what happens when we don't communicate effectively. If we communicated effectively, I think these errors could reduce. That's the importance of learning how to communicate, how to make sure that your information is exactly understood the way you want the person to understand. And the biggest fallacy is we think, I have communicated and the other person has understood. You have seen it yourself in this activity. This was just to give you an idea. Unless you confirm, you will never be able to make out whether the person has really understood what we mean. If we communicate it effectively between us, I think there will be better coordination. Definitely patients safety will be ensured, continuity of care will be looked after. Most of the errors happen during transition of care. When the patient is moved from one care area to another, there is loss of information. Almost 80% of the information gets lost during transition. These are the studies of JCI that I'm sharing with you. If we communicate it effectively, even the risk of allegation of medical negligence will go down. Can you believe that in almost 2/3 of the cases where the patient decided to sue the hospital, it was not because of the error, but it was because of the communication failure on our side. When we don't communicate effectively with the patient and their family member, they feel cheated, they feel deceived, and that is where they decide to sue us to teach us a lesson for the failure of communication. As I said earlier also, communication like complete loss of vision, surgery going wrong, medical error, even conditions like retinoblastoma, injury or infection needing enucleation, these are very, very, serious complications and serious issues to be communicated to the patient. It has a huge impact on the patient and the family. It requires great understanding of how this is going to impact the person and how the person is going to respond or react to the situation. And all these require training, but unfortunately, we don't actually, learn. We learn by making mistakes, and then we feel bad about it. If we communicate it effectively, even day-to-day communication, I'm sure some of you who have wonderful communication, you will enjoy wonderful rapport with your nurses, with your optometrist, with your team, with your juniors, with your seniors. But those of us who have difficulty communicating, they will experience more conflict, more irritation, more frustration with the staff, with patient and their family member. So if we learned effective communication, even the conflicts with others would also go down. Even the risk of violence goes down. Because you may have seen there's a tense situation. We are about to get into a mob attack, and somebody who is very experienced, very knowledgeable comes in, they talk to the patient and their family or the people who are aggressive, and they're able to settle the situation. And we have seen people who just come in and fuel the situation, and the things go out of control. And it's all about communication. If we communicate it effectively, you could actually contain and reduce the risk of mob attack or violence. Of course, better communication will give you, more professional satisfaction and reduced physician burnout. I think this is one thing that we all are crying about, that people are getting burnt out, people are getting exhausted, they are unhappy, they are not liking their profession, they don't want their children to be doctors. That's because we are not happy doing what we are doing. We don't know how to handle the changed situation from where we were respected like gods, and where now we are treated like service provider, and even worse than that. So that means we really need to learn how to change the situation. How will patients be benefited? How do you think patients will be benefited if we communicate it effectively?
That will change their health-seeking behavior.
Okay, very true.
So they will be very much part of the treatment.
Mm-hmm. Absolutely, absolutely. They will feel respected. Yes, Dr. Sachi, Sachi. Yes. Yes, Dr. Asing, you were saying something. Please go ahead.
And they will bring more patients.
They will bring more patients. That will be a benefit to the organization, to us also. Absolutely.
And some mistakes are always going to be there, and that the doctors will find it easier to manage the situation if the communication is well.
Absolutely. So that's again a benefit for us. If we communicated well with the patient, even if things go wrong, the patient will not blame us. They will still consider that we have acted responsible, and we haven't done anything willfully. We haven't done anything wrong willfully, and we tried to do our best. I think I shared this with all of you once earlier also. Dr. K.K. Malik, who was head of the department in Safdarjung Hospital. So I met him in AIIMS Jammu. sorry, not Jammu, Rishikesh. I had gone there for doing a program. And he said that a lot of time patients would literally lose their eyesight after surgery. But they will still come and say, thank you for all the efforts that I made to save the eyesight of the patient. So that has to be the commitment demonstrated in our way of this thing. And that's the benefit of communicating effectively. What other benefits do you think patients will have if you communicated effectively? Dr. Shubhra says patients can gain mental peace after knowing about the disease. Yes, once they know, they will accept that, okay, whatever has been explained in a good manner. Dr. Abhilasha says patients will take informed decisions that will avoid further difficult conversation and will help to adhere. I think this was the answer that I got last this thing. Yeah. Okay. They will feel respected. I think this is what Dr. Sabyasachi has said. Definitely, they'll feel good. Can you believe that actually it can change the outcome? Your effective communication can change the outcome. Let's see how. Lot of studies have shown that if we communicated effectively and patients felt that they had a good communication with their patient, they could actually enjoy better pain control and improved response to the pain management modalities. So a lot of your patients coming with glaucoma, with pain and redness and other symptoms, when you communicate effectively with them, they comply with what you say, they follow up regularly, they put their medicines regularly, they experience better control in their condition and respond to this thing. Chronic conditions like diabetes, high cholesterol, hypertension, HIV, these patients have reported better control and effective management of their condition. Even in cardiac surgeries, studies have shown that the post-operative complications such as cardiac arrhythmias are reduced when you have a better communication with your patient. So it's not just a feel-good factor. It actually changes the outcome. It improves the outcome. Because when the patient trusts you, patient agrees with you, patient aligns with you, patient follows your instructions, they comply with what you say, automatically the outcome becomes better. Even their perception of care is, improved because they feel, oh, you are a good doctor. You have a good team of people. It's a good hospital. So once they see you as a, good doctor, good hospital, their perception about the care changes, their satisfaction goes up. The body starts healing itself. We all talk about healthy hormones, happy hormones. They are the one that improves our immunity. They are the one who improves our recovery. If you are able to create that happy factor in them, feel good factor in them, they go back satisfied, they comply with you, automatically the outcome improves. Of course, organizations will be equally benefited because when you have good work environment, greater job satisfaction, patients are going to score you high. And today is the time of Google review. People go to Google review and write bad reviews if they are not satisfied with you. They see your reviews before they come to you. So your patient experience scores on reviews, on on general, if you are regularly taking patient satisfaction, you will see an improvement. So Dr. Shubhra just now mentioned about improvement in the patient's conversion or acceptance of surgery or glasses once you are doing counseling. Imagine if patient counselors are able to bring in this change in patient's behavior, how good it will be when we all start communicating effectively with our patients. Of course, patients' loyalty will improve. Not only they will come back to you, but they will also recommend to others. They will ask others to visit you, and they will specifically send with your name, go to this doctor, go and ask for this doctor, because they have enjoyed good service from you. Of course, there's a enhanced safety and quality, which benefits all of us, not just the patient, for us also. Safety, quality, good work environment, it's not just for the patient. We spend 6 to 8 hours in our workplace. We go home, I think in your place, I see you are there for almost 10 hours. And actually all your productive hours you are spending in the hospital. We go home just to sleep or to have food or to do our daily activities. So it's very, very important to create good work environment. Otherwise, we all will feel burnt out and stressed out. So in nutshell, I think communication in healthcare is not just about niceties. It's not just good behavior, but it's a therapeutic communication between you and your patient. It's the clinical communication between you and your team members, where you actually pass on patients' information, you exchange patients' information, and that should go accurately. It's part and parcel of the treatment. It's not optional. It's not that, okay, if I don't communicate, I don't communicate. No, if you don't communicate, you are likely to make errors. You're likely to be in trouble tomorrow. So implementing these practices has a direct impact on the continuity of care, patient safety, and treatment outcome. And that's the ultimate purpose of our service to the patient. And there are communication protocols which each one of us should know. In the coming sessions, we are going to talk about these protocols one by one, and we are going to practice them and learn them. And I expect that you will take this forward and you will teach it to your team members and your other staff members. There are multiple ways to learn this. Through this program, of course, we are going to learn. But if you Google search, you'll get a lot of information available on the on the Google also, but one has to keep updating because things change at a very fast pace and we must stay updated. So this is in nutshell about the first session where we talked about the importance and relevance of communication. Any questions about what we have discussed or anything that you wish to ask or say about the session that we have had?
Would you recommend some study material, or you share study material after the session?
So as of now, I have already shared around 70-80 pages document to all of you. I have emailed you. I hope you have received it. I hope you have received it.
Can you mail it once more?
I can do that, no problem. I will mail it once more. I will request all of you to have a look at it. And also, if you could, get hold of this book. I think this is already there in your library. If it is not, I'm sure Orbis can help you get this book for your library because it's very nominally priced, just 300 rupees. Have it and read this. You will find everything, explained in a very, very simple, practical way. I don't like teaching theory. I think the best way to learn is when you can see it happening with you and around you. And that's the best. So in future sessions, there'll be a lot of role plays, a lot of activities, videos that we will watch. And we'll learn how to, learn from those videos also.
Yeah, the initial response from the trainees that you train here is really encouraging. So we are thinking that we'll scale up our internal teaching.
Absolutely.
As we go on.
I'll be more than happy to participate with you, to contribute, to help you, to whatever assistance I can provide in whatever capacity. I'll be more than happy to provide that assistance because I'm looking forward to having more and more trainers in healthcare because this is what is the need of the hour.
Of course.
Thank you.
So actually, good communication inside the organization can really change the organization.
Absolutely. You won't believe the feedback that I received from Dr. Shubhra yesterday when she said that things are changing just because your staff has had that training with me and they're able to counsel better. I think that gave me more than, what I was thinking or expecting. Thank you so much. I think that was a wonderful feedback. And I hope when you try applying this, whatever challenges you all experience, please come back and share your experience with us. We will try to find a solution to those situations and see through discussion what other ways we can, implement in that. So a quick quiz to all of you, because this I'm going to ask you after every session. What different pedagogies I used in this session? Write in the chat box. What different pedagogies I used in this session that you can recollect, write in the chat box. And meanwhile, I'm going to share the feedback form. I want you to give your feedback. Okay, storytelling, yes, PPT. Role play discussion, Role play, discussion, PowerPoint, storytelling. Absolutely. Lecture, case study, role play, interaction with the participants. Absolutely. PPT, storytelling. How about Chinese whisper? Although they don't like it to be called Chinese whisper, but then I use Chinese whisper. How about open-ended questioning? And how about reflective questioning? I used even this. So keep an eye. I keep using a lot of pedagogies just to keep the program interesting, engaging. Otherwise, it's very difficult to hold attention of 10, 15 people for 2 hours and keep them engaged and make them participate. Thank you so much. I've shared the feedback with you. Before you leave, please complete the feedback. I've shared the feedback link in the, it's a very short, very simple feedback form I'm asking for. Just a minute, not more than a minute. Just a quick question. Are you comfortable with the timings? That is 4 to 6 p.m. I've received 5 responses as of now. Waiting for everyone to complete before we close. So 4 to 6 timings are okay with everyone? Dr. Shubhra, is that okay? 4 to 6?
You unmute your mic. Shubhra, unmute your mic.
Actually, we are back home. I am back home by 5. So I can do it while I'm traveling by car.
I request you to come home on that day a little earlier, because we would like to see you joining from home and in comfortably participating. Because on the way, I think network issue. I've seen that you have network issue on the way. It's your call. I think you can, if possible, please join from home. Yeah.
4:30 was fine today.
What I feel, if we start at 4:30, people who are in the hospital, they have to leave. So because I saw Dr. Atul leaving early. So they will not, completely attend the program. That's something it's not advisable.
No, if the other participants feel that they go home and they attend, then we can have it.
I think in HVDesai, they work till 6 o'clock. Their timings are up to 6 o'clock. Okay. That's what is my understanding. But I think Radhika can give her input. Radhika, are you there?
Okay, then for that particular day, we have to schedule it to 4 to 6.
I would request that if we stick to 4 to 6.
Okay.
Okay, done.
It's only because they had CME today and Dr. Ashwini had to present in that CME. So we decided, okay, we'll start half an hour later. So I've received 5 responses. I think, where are others? I can see only Abhilasha, Sabyasachi, Dr. Snehal. Dr. Asim, I have not received your response.
I have sent already.
I've also sent.
Yeah, Dr. Subra, I have received your response. I have not received Dr. Asim's response. Yeah, now I have received it. Yeah. So I've shared the link in the WhatsApp group also. Those who have not completed, I request them to complete and send it. Yeah. So thank you so much. I think we'll close here. It's already, what time it is? 6:45?
Yes.
Yeah. Thank you.
Thank you so much.
Thank you.
Bye-bye.
Thank you, ma'am. Thank you, ma'am. Bye-bye.
God bless you all.